Yes, sir.
Okay, one more student enters. Hiritika. Okay.
Sorry, sir, I was having problems in connecting.
Okay, okay, no problem. Okay, so we must have to first of all think about the know about the structure of the uterus. Now, uterus it consists of fundus. Okay, it consists of fundus. It consists of body. It consists of cervix. Okay, okay. This cervix, this part is the cervix. Okay, this part is the cervix. This cervix is further divided into supravaginal cervix and vaginal cervix, and the cavity or canal which is formed here, this is known as cervical canal. Okay, it is the cervical canal. So this is the internal os of the cervical canal. This is the you can say the external os of the cervix canal. So when this cervix is entering or merging into the vagina, it forms here these structures. Okay, see here, these structures are known as fornix of the vagina. Now, these fornix of the vagina are very, very important. I am going to tell you what is their importance, but these fornix of the vagina are very important. There is anterior fornix, there is posterior fornix, and there are lateral fornix. So, fornix it is a space only. So, when, for example, uterus cervix part entering into the vagina, it forms some fold-like structure or spaces. It is known as vaginal fornix. Okay. Now, fundus, it is the part of the uterus which is present above the uterine tubes. Okay. So, above part of the uterus, above the uterine tube, it is known as the fundus. And mostly the uh, implantation occurs here in the fundus. Okay. Now, this part here I already explained to you. If the cervix, this external os, if it is circular, it means female didn't give birth to the babies. Okay, no babies till the moment. But if it becomes transverse, okay, if it becomes transverse, it means females is multiparous or females already give birth to the babies. Okay, so by just giving just seeing the you can say the external os of the cervix, you can tell that female give birth to the baby or she's not giving birth to the or not giving birth to the babies. Okay, now this portion here, this whole portion here, this is known as the fallopian tubes. Okay, so uterine tubes, fallopian tubes, both are the same. Okay, and this uterine tube or the fallopian tubes, it has also parts. It has intramural part, it has isthmus, it has ampulla, and it has infundibulum and these fimbria. Here your ovaries are present, and when the ovaries will release the ova, these finger-like projections, fimbria will take the ova, and now they will ask the ova to come here. Okay, so whenever, for example, sperm cells or spermatozoa enter through the vagina through here, he will pass through all this pathway through the vagina, through the uterus. Now it will pass the intramural part of the fallopian tube. It will pass the isthmus. Isthmus is also known as, you can say, the anatomical construction, constricted part of the fallopian tubes. And in the ampulla, please remember, very important point, in the ampulla of the uterine tubes, the ova will meet with the sperm. Okay, so fertilization will occur in the ova and the sperm in the ampulla of the fallopian tubes. Please remember, it is very, very important. Fertilization. So you can say that the meeting of ova and the meeting of sperm, it will take place in the ampulla. Okay, in the ampulla of the uterine tube. But after the meeting or after the fertilization, now this fertilized zygote or fertilized structure, it will go through all this structure, and now it will come into the uterus, and now it will be implanted into the uterus. Okay, so please remember, if implantation occurs in the fallopian tubes, if implantation occurs in the fallopian tubes, it is known as ectopic pregnancy. Very, very important clinical correlation. Okay, so this point is also very important. Please remember, normal fertilization of the ovum and the sperm will take place in the ampulla of the uterine tubes. Okay, in the ampulla of the fallopian tubes. Okay, or you can say that two hearts are going to meet here. Okay, two hearts are going to meet here. Two hearts are not going to meet in the park. They are going to meet here in the ampulla of the, you can say, fallopian tubes. Okay, so two hearts are meeting in the ampulla of the fallopian tubes, and when they meet together, the zygote is formed. Now this zygote must have to go into the uterus, and in the uterus it must be implanted, and now it will grow, increase in size and other that, and then your beautiful baby will come out from here. Okay, so please remember, if this implantation occurs abnormally here in the uterine tubes or into the fallopian tubes, it is known as ectopic pregnancy. And why it is important? Please remember, if ectopic pregnancy occurs here and if it bursts, this fallopian tubes and ectopic pregnancy are not covered by the peritoneum. It is a communication of the pelvic cavity with the peritoneal cavity. And when it bursts, it will release the contents into the peritoneal cavity, resulting in peritonitis. Very, very important. Okay. So these points you must have to remember clinically. They are going to ask you these points in fourth year in obstetrics and gynecology, ectopic pregnancy. Okay, normally it must have to be fertilized here in the uterus. Okay, I think it is the fundus part, posterior part of the fundus. It is the most common site of implantation of the zygote. Okay, but fertilization, yes, fertilization is taken place into the ampulla of the fallopian tubes, but implantation, it will be in the uterus. Implantation will be in the uterus. But if the implantation occurs in the fallopian tubes, then it will result in ectopic pregnancy. It is clear to everyone?
Yes, sir.
Okay.
Yes, sir.
Now, other points relating to the uterus. Now, uterus is in this position. Okay, this is known as anteverted and anti-flex position of the uterus. This is the vagina. Okay, this is the rectum. Okay, this is the rectum. This is the vagina, and here your urinary bladder is present here, something like that. Okay, so now when the peritoneum is coming here downward, it will cover here like this. See, now it is covering the uterus. See, double layer of peritoneum. And now it will go downward here, covering the rectum, and now it will go upward. So this pouch, okay, wait, I will draw here this diagram. For example, this is our urinary bladder. Okay, this is our urinary bladder. This is our vagina, and this is the rectum. Okay, this is the rectum or the anal canal. Now the layer of peritoneum is covering. Now see, the peritoneum is covering the superior border of the urinary bladder only. Now it is covering the uterus like this. Now this two layer of peritoneum which is covering the uterus, see here, now it is going downwards like this, going upwards. This double layer of peritoneum, this is known as the broad ligament of uterus. It is known as
Broad ligament of
broad
Broad
ligament of
ligament
uterus.
of uterus.
Okay, And this pouch which is forming here, this pouch which is forming here, this is known as
Douglas
Douglas
pouch.
pouch.
Douglas pouch.
Okay. Now, very important correlation which I am telling you, please remember it forever. Lateral fornix of the vagina, lateral fornix of the vagina, it is in close relation with the ureter. Okay, it is in close relation with the ureter, and above the ureter, the uterine artery is present. What is present?
Uterine
Uterine
artery is
Uterine
artery.
present.
artery.
Uterine
Artery.
artery, which is a branch
Yes,
of
please.
anterior divisions of which artery?
Internal iliac artery.
Very good. It is a branch
Very
Uterine
of
good.
artery.
internal iliac artery, anterior division branch, which is giving the uterine artery. Now it is giving blood supply to the uterus. And under the uterus, under the uterine artery, not under the uterus, under the uterine artery, ureter is present. Okay. So if I want to palpate or check the ureter, the relation, we will go through the lateral fornix. Okay. But if I want to enter into the Douglas pouch, I will use this fornix of the vagina. And this fornix of the vagina, it is your posterior fornix. Okay. So posterior fornix we use for chordosynthesis process. You remember it? Chordosynthesis
Yes, sir.
process. Okay. So chordosynthesis process, you are using posterior fornix. And the lateral fornix of the vagina, they are in close relation to the ureter. Because if you accidentally enter through the lateral fornix, you are going to damage the ureter. Okay. And above the ureter, it is your uterine artery is present. Okay. Above the ureter, uterine artery is present. We called it, the mnemonic is water under the bridge. The bridge is the uterine artery, water is the ureter. So water under the bridge, uterine artery. So please remember these two correlations. Please remember it. Posterior fornix in relation to the Douglas pouch in relation to the chordosynthesis process, and this lateral fornix in relation to the ureter. For example, whenever we are doing hysterectomy, it is a procedure of removal of the uterus. When we are going to remove the uterus, so when we have to remove the uterus, we have to block the uterine artery, which is giving the main blood supply to the uterus. And I must have to be very careful not to damage the ureter, because under the uterine artery, your ureters are passing. What is passing?
Ureters.
Ureter
Ureter.
is passing. And one another important point here, here also a ligament is present, which is also giving a good support to the uterus, to the cervix. It is known as transverse cervical ligament, or we can call it as the cardinal ligament. Okay. So this is
Transverse
also
cervical or cardinal.
what? What? It is the cardinal ligament, or you can call it as the transverse cervical ligament. This cardinal ligament is also in close relation to the ureter and to your uterine artery. Okay. So please remember these correlations are very, very important. Okay. Now the uterus here, it is making these two angles. This is the position of the normal position of the uterus, anteverted, anteflex position. This 90-degree, it is forming between the cervix and it is forming between the vagina. This 170-degree angle, it is forming between the body of the uterus and forming between the vagina. Okay. So this is the normal position of the uterus, you can say. And here there will be presence of the urinary bladder. Here will be the layer of the, this is the peritoneum layer. And this peritoneum, double layer peritoneum, which is covering here the whole uterus. We call this ligament as the
Broad
broad
ligament.
ligament of the uterus. Okay, we called it as the broad
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 ligament
ligament.
of the
ligament of
uterus.
uterus.
Okay, it is clear to everyone. See here, ectopic pregnancy. implantation and growth of fertilized ovum outside the uterine cavity in the uterine tubes. Okay, so it is known as ectopic pregnancy. Okay, this is your ectopic pregnancy. Uterine tubes are present in the upper free border of the broad ligament, and it is a direct route of communication of from vulva and vagina and uterine cavity to the peritoneal cavity. When we study the peritoneal cavity, I explained to you that these tubes are not covered by the peritoneal layer. They are open. So if ectopic pregnancy bursts, what will happen? The secretions will enter into the peritoneal cavity and it can be ruptured. Okay. So sometimes what happens when it ruptures, it can causes peritonitis also. Okay. And what happens sometimes that this blood can enters into the pouch, the Douglas pouch, which is present between the uterus and the rectum region. So you have to remove it by again doing the posterior colpotomy procedure or chaldosynthesis procedure. Why posterior colpotomy? Because you are entering through the posterior fornix of the vagina. That's why these fornix of the vaginas are very important. You must have to know anterior fornix, posterior fornix, and lateral fornix. Lateral fornix in close relation to the ureter. Posterior fornix, you through posterior fornix you enter into the pouch of Douglas, and you can evacuate any bleeding or any secretions which can enter into this cavity. Okay, it is clear to everyone.
Yes, sir.
Yes, sir.
Okay. Now this is the your you can say the ectopic pregnancy showing in the diagram. Okay. See, there is the implantation here. Fertilization occurs in the ampulla. Yes, it is normal, but implantation must be occur into the uterus. Okay. So this is also very important. Supports of the uterus. Now see here the diagram once again. See, this is our ischiorectal fossa. You remember ischiorectal fossa? Here there is our
Yes,
pudendal
the
Total
canal.
eye.
Okay, this is the vagina. Now see here, this is the upper part of vagina. This is the middle part of vagina, and this will be the lower part of vagina. So vagina three parts are supported by three structures. Upper part of vagina is supported by pelvic diaphragm or the levator any muscle. Middle part of the vagina, it is supported by urogenital diaphragm, and lower part of the vagina, it is supported by perineal body. Okay, it is supported by
Perineal
perineal
body.
body. Now, uterus, please remember, uterus good supports. I said to you, it is by the pelvic diaphragm. It is by the, I said to you, urogenital diaphragm. I said to you, it is by your uh, perineal body, right? These are the good support of the uterus. But please remember, another ligament is coming out here. See, this ligament which is attaching to the transverse process. This is known as transverse cervical ligament. It is also known as cardinal ligament.
Cardinal ligament.
And it is also in close relation to your ureters and to your uterine artery. So whenever I am doing hysterectomy procedure, I must be very careful not to damage the ureters. Okay. And this is the internal os, this is the external os, this is the cervical canal, this is the cervical canal, this is the, if it is rounded it is nulliparous, if it is transverse it is multiparous. Okay, so these points are also very important. Okay, now I want to show you the lecture so that it will be easy for you to understand some diagrams relating to it. Female reproductive system, ovaries. Now see here, it is not showing here. Okay, see, this is our which fornix? Posterior
Posterior
fornix.
fornix.
Okay, so from here you can enter into this pouch. This pouch is your rectouterine pouch, or it is also known as Douglas pouch,
Douglas.
because you are entering through the posterior fornix of the vagina. That's why it is known as posterior colpotomy procedure also, or it is also known as chordosynthesis process also. Okay, this is the urinary bladder. Okay, and this is the layer of peritoneum which is covering it. Now you can see that fallopian tubes are not covered by the peritoneum. So if here the implantation occurs, it can burst into the peritoneal cavity, resulting in peritonitis. Blood can enter into this pouch. This pouch is your Douglas pouch. So you have to perform again posterior colpotomy procedure. Okay, clear? Now
Yes,
see
sir.
this diagram. This is the ovarian ligament. See, this is the ovarian ligament, and this ligament here.
Suspensory
This
ligament.
is the suspensory ligament
This
in
is
which your ovarian artery, veins, and nerves are present.
vein.
Okay. This is the broad ligament. This whole sheet which is covering, this is the broad ligament. And this is the uterine artery. See, uterine artery is coming now, giving blood supply to here. This part of the broad ligament, this is known as mesosalpinx. This lower part, this is known as mesometrium. Okay, and this part which is covering the ovaries, this is known as mesoovarium. Okay, okay, it is clear.
Yes,
Yes,
sir.
sir.
Yes, sir.
Okay, now see here this diagram. See, this is the round ligament. I will show you another diagram. This is the uterus, this is the urinary bladder, these are the ovaries, these are the ovaries. Okay, these are your fallopian tubes. Okay, this is the fundus of the uterus. Okay, this is the urinary bladder. I will show you another diagram which will be easy for you to understand. Development of female reproductive system. Okay, this is the ova or egg released from the fallopian tubes. Okay, these are the parts of the uterine tubes you already know: infundibulum, ampulla, isthmus, intramural. Ampulla, it is the site of fertilization. Okay, I want to show you one diagram. Wait for 1 second. This is clear to everyone. See here, these are the fornix. These are the fornix. Cervical canal, external os, internal os. Okay. See, these are the pouches. Okay. Posterior fornix, utrovesical pouch, Douglas pouch, chordosynthesis process. Okay. This is also very important. Please remember this sequence. Okay, uterine artery sequence will be ARBS. Okay, ARBS. Uterine artery will divide into arcuate artery, then it will be further divided into radial artery, basal artery, and spiral artery. Okay, the spiral basal artery will give blood supply up to the basal layer of the uterus, but spiral artery, it will give blood supply to the functional layer of the uterus. Okay, so in the menstruation, when female menstruates, this functional layer will deattaches, and when it deattaches, these spiral arteries will bleed, and this will come out as a in the menstrual cycle. So this functional layer will be dislodged from the basal layer of the uterus. Okay, so this is the sequence of the uterine artery. Uterine artery divide into arcuate artery. Arcuate artery divides into the radial arteries. Then they are divided into the basal arteries, and then this giving branches the spiral arteries. Okay, so you have to remember this sequence also. This spiral artery will slough out. It will give blood supply to the functional layer which will be formed in every menstrual cycle. So when when the females are menstruing, for example, that blood, it is not only the blood, it is also the functional layer which is come out with the menstruation. Okay. Now this is the round ligament of the uterus. See here. Now this is, for example, see here, this is our fallopian tubes. This is our fallopian tubes. Okay. This is the round ligament of ovaries, and this is, see here, this is the round ligament of uterus. Now it is holding the uterus, passing through the inferior epigastric artery, passing into the superficial inguinal ring, deep inguinal ring. Now it is going enter here, and now it will fuse with the labia major in the females. Okay. So round ligament of uterus, please remember, this is the round ligament of uterus, which is giving, which is a component of inguinal canal. It is a component of inguinal canal, not the broad ligament. Broad ligament is a two layer of peritoneum which is covering the uterus. Okay. Round ligament, it is passing through, it is a part of inguinal canal in the females. Okay, it is a part of inguinal canal in the female and fuses in the labia major in the female. This is the part which I am explaining you. Okay, now you can see ovaries are on the posterior surface. Okay, they are on the posterior surface. Here will be, this is the round ligament of ovary, and if you add another ligament here which is attaching here to the pelvis lateral wall, it will be the suspensory ligament of ovary. Okay, so this is our round ligament of uterus, and the ligament which is covering the uterus from all place here, that is the broad ligament of uterus. But please remember, broad ligament of uterus and round ligament of uterus, they are very not a good support to the uterus. It is a very important point. Mostly students think that they are a good support of the uterus. They are not a good support to the uterus. Good support, excellent support are transverse cervical ligament, cardinal ligament, your pelvic diaphragm, urogenital diaphragm, and your perineal body. Okay. Now see here, this is the correlation of the ureter and the uterine artery. See here, it is very important. Okay. We called it as uh, bridge, water under the bridge. Okay, so please, whenever we are doing hysterectomy, we must have to look at the transverse cervical ligament which is present at the base of the peritoneal ligament, and under that your uterine artery is passing, and under the uterine artery your ureter is passing. This is a very important correlation when we are performing hysterectomy procedure. Very important correlation. You must have to know this correlation clinically. Okay, now this is the ligament which I am telling you. Okay, so these are the supporters of the ligament. Round ligament, broad ligament, not good support. Transverse, so this is the transverse ligament, see here, which is attached, this is the cervix of the uterus. There is pubo cervical ligament which is attaching cervix to the pubic bone. There is uterosacral ligament which is attaching cervix to the sacral bone. So these are also the good support to the uterus. Now you can see that uterus has 1, 2, and 3 supports, but these support, this one, the urogenital diaphragm, the pelvic diaphragm, perineal body, these are the excellent support. These ligaments, the transverse ligament, which is also known as the cardinal ligament, okay, pubocervical ligament, uterosacral ligaments, these are good support, but the round and broad ligament, they are not a good support to the uterus. Okay, so whenever prolapse occur, it will be due to these ligaments, or it can be due to the damage to these structures. When these structures are damaged, then the uterus can prolapse. Even the vagina, when prolapse, these structures will be damaged, resulting in uteral prolapse or vaginal prolapse. Okay, this is the same diagram showing you the transverse cervical ligament. It is also known as Mackendorf's ligament. Okay, these structures I already explained to you. That's it for today. It's clear?
Yes, sir.
Yes, sir.
Yes, sir.
If you have any doubt, you can ask. If you have any doubt, you can ask. Hmm? Jissa, everything is clear?
Yes, sir. Up till now, no doubts. Like when I go through to like today, when I'll go through the topic, I'll have doubts.
You can ask me. No problem.
Yes, sir. And so, actually, today I had a surgery lecture, and so taught about abdominal hernia. So there are some things I didn't understand from that. Like he is talking related to surgery, not the
Uh-huh.
anatomy part. So I
Okay.
have some doubts in that.
What are your
So
doubts?
if sir, I didn't go through that properly. I'll ask you tomorrow. Is it okay?
You are in my lecture when I give lecture on hernia,
Yes, sir.
and still you are in doubt.
No, the surgery part. There are some things, sir, I didn't understand properly. Like I'll tell one example.
Okay.
Like retrograde incarceration and all. I took so many screenshots and I kept, but I didn't understand many of the things. But the anatomy part I understood
Okay.
completely.
You send me in the separately in the message. I will check it and then I will inform you. Okay.
Okay, sir.
Rest of thing clear to everyone.
Yes, sir.
Yes.
Okay. This
Yes, sir.
covers our pelvic and pelvic cavity, perineal cavity, male and female reproductive system. Tomorrow I am going to take test of you. Okay.
Yes, sir.
Tomorrow will be test for your male and female reproductive system and perineum also completely with all the diagrams.
Okay, sir.
Okay,
Okay,
so
sir.
be ready for it.
Yes, sir.
Okay,
Okay,
sir.
if everything
Okay,
clear,
sir.
okay, then bye and take care.
Bye, sir.
Okay, sir. Bye, sir. Thank you.